Hi, Susie. How has things been since we last met?
They've been good. Just watching my neighbor's dog. She has her dog cousin over, and so just hanging out.
Hey, that's good. You can play with the animals, which can definitely help
hmm
keep your mind at ease. Um,
hmm
so, um, I am so sorry. I had something pop up on my screen. Um, so last time we met, we were able to talk about um, uh, about your traumatic event with your car accident, and that happened 4 years ago. And we were able to do an assessment, which was the PCL-5. Um, so today in our session, my goal is that we will go over a little bit about what what we rated things with the 3 and the 4. That was my main concern. Um, talk a little bit about that, talk about where I came with my assumption of our your diagnosis and treatment plans and um all of that. So do you have any questions before I get started? We get started.
No.
Okay. Yeah, so last time, I don't know if you have this in front of you, from what we did with the assessment, but um some of the things that I want to talk about does, correlate with PTSD, which is post post-traumatic stress disorder, kind of like what I mentioned last time as well. Um, so looking at this, some of your high scores was suddenly feeling or acting as if the stressful experience were actually happening again. So you were telling me when you go on that exit, sometimes that can retrigger some of your emotions and feelings. So that's accurate, right? Do you believe that's, still happening?
Yeah, and when I'm with, um, as I said, when I'm in the passenger seat with my husband, pretty much like anytime he's behind another car, in front of another car, that's I'm like gripping the
Yeah,
seat and stuff.
yeah. And that's reasonable. You just went through this, it's been 4 years ago, but it can still be, hard on our bodies when, we don't know how to react. So all right, so that was one thing. Another thing you scored a 4 on. So again, I forgot to refresh our memories, but 3 was quite a bit, and then 4 was extremely. So for 4, you said you were feeling very upset when something reminded you of the stressful experience.
hmm
Yeah. So yeah, that's probably one of the common symptoms, I would say. So that's normal. 5, you said 3 quite a bit for this one. Having a strong physical reactions when something is reminded you of that stressful experience. So heart pounding, trouble breathing, and sweating. So we didn't really get into this last session, but I'm curious, like, what do you feel when you are in that situation?
Well, like if we are behind um another car or like I said in front of a car, basically if my husband doesn't go to a lane that has no cars or like take a back road or something, um I'm just really hyper vigilant. I'm like grasping the door or whatever the handle. My heart is pounding. I'm really tense and um I mean we live in a city area and so if we go someplace and it's like rush hour, um, like I said, pretty much anytime he breaks or the person in front of him breaks, if I'm paying attention, which I am if I'm not like in the back seat, um, I it's like a very strong reaction and I'm like pushing my feet like into the car, like the
Mhm.
floor,
Yeah.
trying to like brace myself, even if we're not close to them. It's just like once it breaks, that's like what my body's doing.
Yeah.
So
Well, thank you for sharing that with me. Since we didn't really talk about that last time, but it's, it is hard, and it's our body's initial reaction, telling us that something is wrong and, something's not right. So I hope that, as we continue to work together, that some of those feelings and the urges kind of stop. Um, so yeah, and then moving down from the questions, another thing was, blaming yourself or someone else for the stressful experience of what happened after it. And you said a 3 for that one. So do you blame yourself and or blame other people or kind of both?
I don't blame myself because I was literally at a stoplight, like I was following traffic. There's nothing I could do, but I do think about, well, maybe this is blame. I do think about um, everything I did that day. It was like, okay, I had some visits at work, and then I had a car seat to drop off at my sister's because I had forgotten to drop it off with her a few days before. And so it was like, I left at a different place and then I made a pit stop and then I was coming
Mhm.
home. And I think, like, what if I, didn't do those things? What if I went a different way? What if, um, I don't know, but I definitely blame her because, um, if you come off an exit and there's a red light and you hit someone, like clearly you're not paying attention, um, for whatever reason. So I do blame her, but I guess maybe it is a little blame that the woulda, coulda, shouldas.
Yeah, yeah. Yeah, I tell, clients a lot that it's hard because we can't control other people and what they do and how they act and behave. So I want you to know that there's no way that you could have stopped her from hitting you. So I don't want you to put, blame on yourself either. It's hard to experience a car accident, but again, I hope we can work together and help those, feelings of self-blame to go away. So yeah, there were some other areas on our assessment that were pretty high. And so that's how I determined that you have PTSD. Again, that's
Okay.
post-traumatic stress disorder. So have you heard of PTSD before? I know I mentioned it last time, but do you kind of know like its role and what it does?
Yeah. Um, yeah, I know a little. I have some friends who have it. So I know a little, yeah.
Okay, yeah. So, just kind of a refresher then that PTSD is when someone has experienced an anxiety problem that develops after a traumatic event. So, with you in this car accident, after 4 years, it still triggers you in some way. Um, so it not just, like you mentioned, it physically harmed you, but it also emotionally damaged you in some way. So now our brains have to kind of shift to the normal state because now it's still in that, trauma brain where it's still like reliving those memories from the car accident. So um, and in a result of having PTSD, sometimes with our symptoms and behaviors, it affects our everyday living. So,
Hmm.
um, so with that and like looking at my the DSM, there were some symptoms that you were, telling me with the irritability and other concerns that you have. So, another way I want you, because I want to kind of explain a little bit more of how our brains work in the time like this. So there's 3 different parts of our brain, and the main one that I'm going to talk about is the reptilian side of the brain, where it's kind of like our survival instinct. So it's kind of like telling us like what do we need to do. And like in those moments, like you just mentioned, when you're in a car, your survival is to, pretend like you're putting on the brakes and you're holding on to something. So that's your body processing like the situation that you're in. So um when with a traumatic event, it shifts our body into like this shutting down mode. And it affects our body and our mind, and it also affects our sympathetic nervous system. And it increases like those stress hormones and puts our bodies into I don't know if you heard of this saying, but the flight, fight, and freeze mode. So have you heard of that before? Okay.
Hmm.
Yeah, so that's what happens when we experience a traumatic event. So, um, do you have any questions of what I just kind of, quickly summed up of like how our brains,
No, I
react?
think that makes sense for what's happening.
Yeah. Um, so now that we know your diagnosis, like how does that make you feel? Does it make you more like concerned or nervous? Or since I kind of explained it more, is it like, okay, I know what it is now. Now we can like work towards, figuring out
Yeah,
how, yeah, kind of like that way.
yeah.
Yeah. Um, so I'm curious, like last time you said you do meditation. What are some other things that you do to kind of help yourself in those times when you feel that anxiety rushing through your body?
I don't go in the car. I'm a shut-in now. Um, I try and tell myself like it's okay, but I know we can lie to ourselves and our brain like can eventually, learn that. But I can't tell myself like it's okay, you're safe in the car because I just
Yeah.
don't believe that. And it yeah, I guess I just oh, excuse me. I guess I just try and I don't know, I guess I just wait for the reaction and then I just try and like get myself calmed down enough that I can do whatever I'm doing. So like if we're going to the mall or something, um, I might have to sit in the car for like 5 or 10 or 30 minutes or something to like calm
Mhm.
down before I get out. So
Yeah. Well, in that, you should be kind of proud of yourself because I heard some, calming and coping strategies of what you just told me. You said sometimes when you're in the car, you try to think, I'm safe, because even though you said sometimes you don't believe that because, yeah, it can be unsafe when we drive. There are drivers out there who aren't safe. Obviously, you got in a car accident, but that is one way to kind of calm our bodies is when we think positively, so positive self-talk. So I I would, say continue that because that's a huge thing. Um, so yeah, I mean, I'm glad that are, trying, and, it can be hard, but you're working hard towards, helping yourself. So there's some other treatments that I love to go over with you, and I can kind of explain some of them, and like
yeah,
also, maybe we can both figure out like what you would prefer. Um, but for PTSD, one of the treatments we have is CBT, which is cognitive behavior therapy. So this kind of addresses what you're feeling, what are your thoughts, um, and then it's supposed to like relate to your traumatic event. So in some ways, kind of like talk therapy, like we talk through all these different things, and we identify your your unhelpful thinking patterns, and those distortions, and we try to kind of like flip it. We try to make them more positive, and we try to, change those distortions, and we'll we try to like then replace it to realistic and appropriate
Okay.
and positive thoughts. Um, and then so that's one. Another one is EMDR, which is eye movement desensitization and reprocessing. Um, so this is a form of treatment that I personally won't be able to help you with because I'm not trained in it. However, I've had clients refer to another clinician and they've said it has worked really well.
Okay.
So it's kind of works our memory in our brain and how like our trauma is stored in our brain, but then it reducing and eliminating those problematic systems and feelings inside your brain. So that's another one. Um, and again, I would refer you to someone because I'm not sure how that works because I'm not certified. But then there's another one, which is exposure therapy. So we're kind of exposing you to um being in the car and not wanting to sit in the back seat and not having those urges and like those, those quick things and reactions to hold on to something, and um kind of help you like feel more comfortable. Like we work our way up to where you are comfortable. So it's kind of like exposing you, pushing you a little bit out of your comfort zone, to help you with that. Um, and there's also art therapy. Um, there's also like if you like writing, that's another form of, helping yourself. And then there there's some other like small ones, like we can talk about them, like calming strategies, like we mentioned before, like positive self-talk, deep breathing, playing a game or coloring, taking going on a walk, meditating, like you said, talking to someone besides myself. So like talking to your husband, like you said, he's very understandable. So maybe doing more of that, exercising, thinking of happy thoughts, writing in a journal, like I said, and just staying busy. Um, I know I just said a whole lot. So um, what what are your thoughts? Like when I say all these treatments and these calming strategies, like I know it's overwhelming, but do
Hmm.
you have any questions about any of them, or any thoughts of, oh yeah, this might be interesting to try, or could I try this, or have any questions?
I guess maybe about the one where I'm like exposed to the car.
Yeah, so we kind of work our way up to where you are comfortable. So like for example, we would start something small. So um maybe like going up to the car like you're about to get into the passenger side, but maybe you're not about to go on a road trip or going to work or something. Maybe you're just sitting in your driveway, and then we just work it up. So maybe um instead of your husband or whoever like chauffeuring you in the back, maybe you start moving up to the front. Maybe you are on, maybe you're driving and then your husband's in the passenger side and you go on that exit together, that there was the accident that happened. So it's just working our way up to um how it should be, because we don't want you to keep pulling back and being resistant, um because we want you to get better. We want to get back into the norm of being in a car, not being afraid of being in the car, and not being afraid of the exit that you go on. So it's just like slowly inching our way forward through different exposure activities. Does that make sense?
Yeah, I think that one would be the best because like I'm not good at art and
Yeah.
I am sick of talking about it kind of,
Yeah.
and you're not trained in the other one, so that probably would be the best.
Yeah. Yeah, we can definitely work on that together. Um, what about the calming and coping like different strategies that I mentioned too? Because with our session today, we won't be able to start exposure therapy. And so with these smaller strategies, mindful techniques, it can kind of help our heart rates to kind of be lowered. So if you're in the car and your heart is starting to race and you feel very uncomfortable and uneasy, what do you think you could do from now until then to kind of, help yourself in those moments?
Yeah, maybe I could try some grounding techniques.
Yeah.
Um, but like softer ones, like not, pushing my feet into the floor or something.
Yeah, for sure. Do you ever like take deep breaths when you're in the car, when you feel anxious and okay. How does your body
No,
feel?
I
No?
probably could do it more because I'm guessing
Yeah.
if I'm still getting to that stage, I'm probably not doing it like enough beforehand.
Hmm.
Um, maybe I could do some like stretches or something because my body gets really tense. So maybe something like that.
Yeah. Yeah, even for myself, I struggle doing deep breathing and certain strategies, work for others and some of the time it doesn't. But the more we practice it, the more it's going to help and the more that we're going to feel better. And so when we practice, breathing, and there's a lot of breathing techniques out there, but for example, like deep breathing, if we continue to practice that in those moments, it can kind of slow down our bodies and kind of help us to get back into this normal state rather than being in that anxious, irritable moment type of feeling. Does that make sense?
Yeah, I feel like maybe if I started it, if I'm in the passenger seat, like right when I get in the car, um, maybe even before like we leave the driveway or something, um, maybe that would help.
Yeah. Yeah, that would be, I would definitely try that. I think that would be good. If you started to do that and then kind of recognize how your body reacts after that. Um, because sometimes when we are uneasy, like we might have like some chest pain or headaches, and like when we slow it down, it can help us feel better. um so yeah, I recommend that. um so yeah, there's that, and then again, like you mentioned, maybe try positive self-talk too. So instead of instantly thinking of the worst, like I'm gonna get in an accident or I'm unsafe, someone's gonna hit me, try to think of the positive of like, I'm okay. I will get to my destination. I got this. It'll be
Yeah,
okay. Doesn't
still
yeah.
true, but like just a different level. Like, yeah, I get what you're saying. Yeah.
Yeah. And I mean that's really hard to say that when you aren't really sure of the outcome. But when we think more positively, then we respond more positively. And then we're not in that negative um way and feeling. So yeah, I think we're starting on the right track. I think once we continue more sessions and we start trying more of the exposure therapy and talking a little bit more of how we can help you, because it's a team effort. I can't do the healing for you. You have to work on it yourself as well. So yeah, your homework, from now until next time is to do those deep breathings. When you do get in the car, recognize how your body reacts. When you do take those deep breaths, or when you do think of those positive self-talk, affirmations, because I think you already know like how your body responds to how when it's anxious and when it's, you know,
Yeah.
yeah. So start recognizing what happens when you do take deep breaths, when you do positive self-talk, and anything meditation, like you mentioned, at home or anything. And again, you can still, talk to your husband as well. And if you need from anything from now until our next session, you can also give our office a call. And I'll be willing to help you and continue to help you, and I hope that you'll want to continue working together, because I think we can make some great progress together. So do you have any
Cool.
questions or concerns before our session ends for today?
No, I think I'm good.
Awesome. So yeah, I look forward to hearing, your results of like how you feel after we try those calming strategies, and continue to, stay positive, and talk to people if you need to. So I'm always here for you, and I hope you have a good rest of your day, Susie.
Thank you.
You're welcome. Bye.